Hey everyone, Prof G here, and in today's video, we're going to be showcasing the entire physical exam from head to toe, start to finish, all in one video. So if you haven't had a chance to check out my other series of videos showing the instructional demonstrations of how to perform physical exams, I definitely recommend that you watch those first. This should be kind of the last thing you watch to kind of brush up on the flow from one exam to the other. Now, I didn't do all of this in one sitting. This is a compilation of different videos that I've been doing over the series of a few weeks, but it does show the physical exam from head to toe and the flow. All right, so if you want to check that out, just stay tuned.
Hi, my name is Christina. I'll be a physician assistant student taking care of you today. Is it all right if we proceed with the physical exam?
Yes.
All right, can you tell me your name and your date of birth?
Yes. Aisa Rodriguez, 0131, 2001.
All right, thanks. So let's start by talking about where we are right now. Can you tell me where you are?
Yes, at UTRGB.
All right, and can you tell me today's date?
Yes, February 13th, 2025.
Great. All right. So the patient is alert and oriented ×3. They have a normal affect, mood, and manner. They appear to be in a normal state of health. They are also conscious with no signs of distress. They have a normal body habitus and posture. They are appropriately dressed, and they have appropriate grooming and hygiene, and they have normal coherent speech. All right, now we're going to move on to take some vital signs, okay? So I'm just going to start by checking your pulse. All right, let's just take this up here. Just relax. Good. Okay, the pulse was 64, regular, and the pulses were equal bilaterally. Respirations were at 14, regular, non-labored, with a normal pattern, depth, and effort. All right, now we're going to move on to checking your blood pressure. We're going to use the left arm over here. Okay, we're going to start by checking the upper limit. So I'm just going to feel your pulse here while I tighten it up. You're going to feel some squeezing on your arm a little bit, okay? All right, found your upper limit. All right, I'm going to let that rest for just a second. I'm going to check your pulse here. Good, you got your brachial pulse. Now we're going to check your blood pressure. So let's go ahead and rest your arm on mine just to... There you go. All right. All right, your pulse is 98/50. Do you usually run a little low?
Yes.
All right. Okay, and next we're going to move on to the skin exam. All right, Aisa, we're going to move on to doing your skin exam, okay? I'm just going to touch in a few parts on your skin and feel for some different things, okay? So we're going to start with the temperature. Have you noticed any changes in your skin at all? Any changes in the color?
No.
Any changes in the texture of the skin? Any abnormal new lesions, moles, anything new?
No.
Okay. And any color change? You said no, right?
No.
Okay. So I'm just feeling for texture, the moisture of the skin. I'm going to go ahead and pinch the top of your hand, okay? So just gentle. Just checking to make sure you're well hydrated. And then we're going to take a look at the skin and the nails, okay? So I'm just going to look, and I see that they're painted here, but we would be checking here for the refill, capillary refill. Same thing here. All right, and I'm just going to look at the moisture of your mouth. If you could just open up for me, please. Very good. Okay. So if we notice that our patient has nail polish in place, another place that we can check for capillary refill is on the side of the nail, where you can look along the edge, or you can look at the fingertips themselves for capillary refill, so you can see that you have good capillary refill here. All right, now we're going to go ahead and assess your hair, your scalp, your skull, and your face. Okay, so I'm just going to look and palpate and looking at your hair. Any issues that you've noticed?
No.
Okay, just kind of looking at the hair. And now I'm just going to palpate your head. Good, and your face. Very good. Now if you could just open and close your jaw. Very good. Good. Now bite down as hard as you can. Very good. Now smile really big. Good. Stick your tongue out. All right. Very good. Puff out your cheeks really big. Don't let me pop them. Okay. Raise your eyebrows. Okay. Close your eyes and don't let me open them. Very good. All right, and that's it. All right, next up, we're going to go ahead and look at your eye exam, okay? We're going to start by testing your vision. Now, are you wearing any contacts?
No.
Or do you wear glasses?
No.
No? Okay. So what we're going to do is I'm going to measure this out, and we're going to test your vision. So I'm going to hold this here. I'm going to have you hold one hand in front of your left eye, so you can block that side. I'm going to have you read the smallest line you can from left to right.
563297.
Great. Now, if you can cover the right eye and do the same thing from right to left.
563297.
All right, great. You have a 20/20 vision uncorrected. All right, moving on. Next, what I'm going to have you do is stare just straight ahead, and I'm going to wiggle my fingers kind of behind you, and when you see them come into peripheral vision, then you let me know, okay? I'm going to do this 3 times. So we're going to start back here.
Yes.
Okay.
Yes. Yes.
Wow, that was great. All right, so normal peripheral vision. Again. All right, next up I'm going to look at your eyebrows and your lashes, the normal lash distribution. All right, and close your eyes, your eyelids open. Very good. Next up, I'm going to gently touch your eyes. So if you can close them gently, I'm going to just palpate here on your eyeballs, up on your gland, and right here on your duct. Very good. Now I'm going to look at your conjunctiva. If you could just look up for me. Good, to the left, right. And then I'm going to have you look down. Good, sclera and conjunctiva look nice and normal. Next up, we're going to do the extraocular movements. Okay, so I'm going to have you stare at the tip of my pen and follow it without moving your head. Okay, so right here. Very good. Normal extraocular movements, normal convergence and divergence. Now I'm going to go ahead and shine the light in your eye. You can just look straight ahead. So normal eye position alignment. Normal anterior chamber and cornea. You can just look straight ahead for me. Normal direct and consensual pupillary constriction. All right, last but not least, we're going to take a look at the back structures of your eyes, like inside your eye, okay? And it is going to be a little bit bright, so just bear with me. I'm going to ask you to just kind of pick a spot on the wall over my shoulder and stare at that, okay? All right. All right, you found the red reflex. All right, look at my light. Very good. All right, let's take a look at the other one. Okay, very good. Got the red reflex, looking at the optic disc, the vessels, and then look straight at my light, and the macula. Quick look. All right, that concludes the eye exam. Next, we'll move on to the ear exam. So next up, we're going to go ahead and do an ear exam. So I'm going to start by inspecting your outer ear. I'm looking at your auricle, your meatus, and then your mastoid process. Any tenderness back there?
No.
Okay. Now I'm going to take a look inside of your ear. So I'm going to take this off, put this on, And I'm going to select the appropriate size of speculum for you. All right. I'm just going to take a look inside your ear. Great. Extra-auditory canal and tympanic membrane look normal. Great. Same thing on this side. Looks great. All right, moving on. We're going to do a hearing test, okay? So I'm going to ask you to cover that ear on that side, and I'm going to whisper a word if you can tell me what I say, okay? Baseball.
Baseball.
Very good. Now on the other side, cover that one.
Apple.
Very good. Okay. So next up, I'm going to use a tuning fork. It's going to make a noise, kind of like what you can hear here. I'm going to ring it, and I'm going to place it on the top of your head up here, and I want you to tell me if you can hear it the same on both sides, okay?
Yes.
All right. Now I'm going to ring it. I'm going to place it behind your ear. You're going to hear it. Once you stop hearing it, say yes. I'll move it in front of your ear, and then say yes when you stop hearing it again, okay?
Yes. Yes.
Very good. Same thing on the other side.
Yes. Yes.
All right, perfect. All right, that concludes the ear exam. Next, we'll move on to your nose. All right, next up, we're going to do an examination of your nose, okay? So I'm just going to start by looking at the external nose and the nares. Okay, and I'm going to also palpate your sinuses. Let me know if you have any tenderness, okay? Any tenderness there?
No.
I'm also going to percuss your sinuses. Any pain?
No.
Great. All right, next we're going to test for the patency to make sure your nose is nice and open, okay? So I'm going to have you cover one nostril and then breathe out for me. Very good. Same thing on the other side. All right, next up we're going to test your sense of smell. So I'm going to have you close your eyes and cover one nostril, and I'm going to put a scent in front of you. You're going to let me know what you're smelling, okay? Let's start with the right side. Perfect. All right, you have your eyes nice and closed. All right, taste, smell.
Vapor rub.
Okay, Vicks. All right, perfect. This side. Same thing.
Germex.
Very good. Excellent. So that's your cranial nerve 1 intact. Excellent. Next, we're going to move on to the nasoscopic exam. So we're going to look inside your nose. Okay. So I'm just going to gently look in. All right. Looking at the nasal septum, the mucosa, and the turbinates. They both look nice and normal. All right, and that's it. All right, next up we're going to do your mouth exam. So I'm going to take a look inside with my light. Any issues with your mouth? Okay. All right, let's take a look. So first up, just open gently, not too wide. I'm going to check your lips. Very good. I'm looking at your teeth and gums. Open a little bit wider for me. I'm looking at your buccal mucosa. Very good. Your tongue, can you lift your tongue to the roof of your mouth? Very good. Looking at the floor of the mouth. The hard palate. All right, can you stick your tongue out a little bit? I'm going to stick my tongue depressor. Can you say ah? Very good. Excellent. Look at the hard palate, your posterior pharynx, your tonsillar pillars, your uvula, and your tonsils. Okay. All right. And last but not least, if I can have you stick your tongue out and move it from side to side. Good. So cranial nerve 12 is intact. All right, next up we're going to do the neck exam. So I'm just going to have you look ahead and just gently raise your neck up just a little bit. I'm just inspecting the neck and the thyroid area. I'm also looking at your trachea. Make sure it's nice and midline, which it looks like it is. I'm also looking at your laryngeal prominence, your cricoid cartilage, and right here your thyroid. If you could just swallow for me. Very good. Okay, I'm going to have you swing your legs on that side of the bed so that I can palpate your thyroid. So again, I'm going to feel right here, right on you. Just let me know if it's uncomfortable at all. I'm going to push to the side, kind of palpate here. Okay, same thing the other way. Very good. All right, your thyroid feels nice and normal. If you can swing your legs this way, I'm going to check your lymph nodes, okay? So I'm going to check your preauricular, postauricular, occipital, tonsillar, submandibular, submental, the superficial cervical, posterior cervical, deep cervical. And if you could shrug your shoulders, your supraclavicular, Very good. Now shrug them again. Very good. And I just tested for cranial nerve 11. All right, now we're going to move on to the lung exam, okay? So first I'm going to ask if I can pull your gown down a little to inspect your chest, okay? So I'm going to pull this down. I'm looking at the chest, the rate of breathing, the depth, the effort of breathing. I'm also looking at the use of accessory muscles, which she doesn't have any. And I'm also looking to make sure that she has a normal chest configuration, which she does, okay? Next I'm going to palpate some bony landmarks, okay? So I'm just going to touch along here on the clavicle, the jugular notch, sternal angle in rib 2, the sternum, and I'm going to lift up right underneath here, feel the xiphoid process. Okay, I'm going to have you swing your legs over to that side over there so that I can palpate the vertebral prominence. Come down, feel the inferior angles of the scapula, 12th rib and vertebrae. All right, now I'm going to place my hand back here. I'm going to have you take a big deep breath in and out. Good. Okay. Next up, I'm going to check for tactile firmness. So every time you feel my hands touch, you're going to say the word 99. Okay? So.
99, 99, 99.
Very good. Now I'm going to percuss back here. So if you can hug yourself in the front. Okay. I'm just going to do a few percussions. Very good. All right, you can swing your legs back to the front. I'm going to do the same thing. When I touch your hands, when I touch my hands, you're going to say 99. Okay?
99, 99, 99.
Very good. Now I'm going to percuss up here in the front as well. And then do one on this side. And the other on this side. Okay, good. Now I'm going to listen. Okay, so I'm going to listen every time I touch my stethoscope to your chest, taking a big deep breath in and out through your mouth. Okay, I'm going to listen to the back, same thing. Just a few more on the sides here. Good. And two more on this side. Good. Okay. Thank you. Hopefully not too lightheaded there. All right. Okay. And that concludes the lung exam. Next, we'll move on to the heart exam. All right. Next up, we're going to move on to the cardio exam. So again, I'm going to kind of pull this down, and we're going to lay you back. Okay. So I'm going to pull this out. Hopefully I can get it. There we go. Lay you back, and I'm going to cover this up, your legs, just for your comfort. Just going to put this right here. All right, we're going to pull this down and inspect first. Okay, so I'm inspecting your neck, looking at your carotid pulses. I'm also looking at your precordium for any heaves or pulsations, and I'm looking at your PMI. Next, we're going to measure your JVD. So I'm going to take this and ask you to turn slightly to your left-hand side. If I can get this off of here. Okay, all right. So I'm going to find your sternal angle right here. I'm going to place my ruler on here. And I'm going to find the area of pulsation. And I'm going to measure across. So it's definitely less than 3 centimeters, so that's normal. Very good. Next, we're going to move on to palpation. So I'm going to go ahead and palpate your carotid pulses. Very good. Now we're going to move on to feeling some of your cardiac points. Okay, so I'm going to touch with the pads on my fingers and then the palm. So Feeling for any heaves or thrills. And I'm also going to try to feel for your PMI, which is right up underneath here. Okay. Next up, I'm going to listen to your chest in those same spots, okay? But first, I'm going to listen to your neck, the carotids. Okay, so I'm going to switch over to my bell. Good. All right, I'm going to listen to your chest. You can just breathe normally. Okay, I'm going to borrow your wrist. Good. Now I'm going to have you turn towards that side that way and kind of roll on your side. I'm going to listen in the same spot. Very good. And last thing, I'm going to have you sit up for me. Sit up. All right. I'm going to pull this down one more time. I'm going to listen right around here. I'm going to have you lean forward. And I want you to breathe out all the way and hold it. Okay, you can breathe. Put this back up for you. All right, and that completes the heart exam. Next, we'll move on to your abdomen exam. All right, next we're going to move on to your abdomen exam, but let me just lower this down to flat. All right, you can go ahead and lay back for me. I'm going to pull this out for you. All right, and for this exam, I'm going to have to expose your abdomen, okay? So I'm going to pull your gown up to about right there. And I'm going to keep you covered down here, okay? So first off, I'm just going to inspect. At this point, in a little bit, I'm going to ask you to bend your knees, but for right now, I'm just going to inspect. I'm looking for any scars or asymmetry. Have you had any trouble with your abdomen? No? So before I get it agitated, I'm going to listen to it, okay? Okay, and now I'm going to listen to a couple other spots. So I'm going to listen to your abdominal aorta, your renal arteries, and then I'm going to listen to your pulse down in the groin area. Is that all right with you? Okay, so I'm going to listen here for femoral and here for femoral. Okay, also in that area, I need to palpate your femoral lymph nodes. Okay, so just in this area, so I'm going to do right here and the same thing on this side. Okay, very good. Now we're going to move on to percussion of the abdomen. So I'm going to percuss and then I'll have you bend your knees up. So. All right, you can go ahead and bend your knees. Okay, we're going to palpate. So I want you to let me know if any of this is uncomfortable or hurts. Okay, so just gentle palpation. Okay, any pain? Okay, now I'm going to do the same thing, but just a little deeper, okay? Again, let me know if it hurts. I know it's a little uncomfortable to have someone pushing in your stomach. Okay, very good. Now I'm going to push your abdomen down. I want you to let me know if it hurts at all when I push in or when I let go, okay? So, any pain? Any pain? No. Okay. Next up, we're going to percuss your liver span. Okay, so I'm going to start down here, and you're going to hear me percuss. Okay, right there's your lower border. And now I'm going to lift up just a little more so I can see this area right here. Okay, so the liver span is right there, normal size. I'm going to palpate your liver now. So I'm going to stick my hand up underneath here. And I'm going to, you taking a deep breath? Good. Okay, you can breathe out. Next, we're going to percuss your spleen. So again, I'm going to move this way. We're going to percuss over here. Okay, taking a deep breath and hold it. Very good. All right, you can go to breathe normal. I'm going to stick my hand up underneath here, and I'm going to palpate your spleen. All right, taking a big deep breath for me. Good. All right, breathe out. I'm going to have you turn towards me a little bit. I'm going to palpate the same thing, okay? Again, taking a big deep breath in and out. Very good. Okay. All right, I'll have you sit up. One last thing. If you can swing your legs this way, I'll come on this side real quick to show. We're going to do CVA tenderness. So you're just going to let me know if it hurts, okay? So we'll start over here. Any pain, discomfort? Pain, discomfort? Cool. All right, and that completes the abdominal exam. You can go ahead and swing this way. And next, we'll move on to your musculoskeletal exam. All right, next up, we're going to test your lower limbs, okay? So I'm going to have you lay back down for this part. Okay, and I'm going to lift your gown up, but not too high, just at the hip level. And I'm going to move the drape so I can see your lower limbs. Okay? So I'll put this over here. So first off, I'm going to look at your hips. I'm inspecting, and I'm going to go ahead and palpate at the same time, rocking your hips. I'm going to start with this leg. You just let me know if anything is uncomfortable, if it hurts, okay? Okay, check capillary refill. Good. No pain or anything on here? Okay, I'm going to check your pulses. Very good. All right, I'm going to check this pulse back here, so just relax your leg, okay? Okay, same thing here. Alrighty, checked all your pulses. So now we're going to do some range of motion of your legs. So I'm going to stand back here. You kind of follow what I do. So you're going to lift your right leg all the way up as high as you can. Good. Now take it back down. Now out as far as you can. Good. Back. And then kind of cross over a little bit. Good. Now bring your heel to your knee and then rotate out and back in. Very good. Now I'm going to do that for you. Okay. So I'm going to lift it up and out. Cross over. I'm going to bend here. I'm going to go out and in. Very good. Okay, we're going to do the same thing on this side over here. Okay, so I'm going to come on this side. I'm going to have you lift this one up all the way. Good. Down and out. Good. In and cross. Good. Now bring your heel up, out, and in. Very good. I'm going to do that for you. I'm going to come up. Down. I'm going to take you out this way. Cross over. I'm going to have you bend here. I'm going to get you out and in. Very good. All right, now we need to test you for some strength. So I'm going to have you lift your leg up. Okay, same thing on this side. Good. Now let's do out. Can you go out? Good. In. Good. And then can you go back? Good. This one. All right, now bend your knee up this way. Push out. Push in. Good. I'm going to do the same thing on this side. You can bend that one and go in, out. Very good. Have you roll on your side that way. And I just want you to bring your hip out backwards towards me as far as you can. Good. Now I'm going to do that for you. So, all right. Now I want you to roll on the opposite side and do the same thing. Bring this leg back as far as you can. Good. And now I'm going to do it for you. Okay. Very good. All right, so we tested strength, everything. Now we're going to test your knees. So I'm going to have you bring your heel again all the way to your buttock on that side, as far as you can. Very good. Now out. Same thing on this side. Good, and out. Now I'm going to do that for you. So I'm going to brace your knee. Any history of knee injuries? No. All right, good range of motion. I'm going to have you sit you up first for the strength of the knee. So if you could sit up. All right, so now if you push out and then push back. Good, same thing here, out, back. Very good. Now we're going to do your ankles. So lift up, ankles down, and then in and out. Good. I'm going to do that for you here. So up, down, in, out, up, down, in, out. Very good. And I'll have you push up and push down. Good. And pat your ankles for me. Very good. All right. Now I want you to scrunch your toes really good and out. Okay. And that finishes our lower limb. We're going to do the spine next. So can I have you stand up for that? All right. I'm going to tie this up so that it doesn't fall on us. Just quickly. I'm going to have you face this direction if you can. Right here, like this. There you go. Now, if you could bend over, touch your toes. We're going to check flexion of the spine. Very good. Now you can stand up, hands on your hips, and bend backward a little bit. Good. Now, side, like you're picking up luggage on this side. Very good. On the other side. And now I'm going to hold your hips, and I want you to rotate from one side to the other. So rotate left or right and rotate left. Very good. And I'm going to have you bend over one more time. I'm going to check your alignment and check for any step-offs or any abnormalities at the back. Well, that looks good. Okay. From here, I'll actually have you walk. Okay. So I'm going to have you walk just a few steps forward normally. Good. Turn around, come back. This one, I want you to do heel to toe, heel to toe. Good. Very good. Next, I'm going to have you walk that way on your tippy toes. Good. And then come back on your heels. All right, and that's where we'll finish off for this exam. Thank you. All right, now that we've done your lower limb, I'm going to start with your neck. Okay, so we're going to have you follow my movement. So chin to your chest, good. Then back as far as you can. All right, now ear to your shoulder and opposite. Very good. Now I want you to rotate, rotate, and then the other side. Excellent. Now you're going to do it against some force. So I want you to push forward against my hand. Very good. Push back against my hand. Push to the side. And same thing here. And I want you to turn your neck towards my fingers. Very good. Turn. Very good. All right. I'm just inspecting your neck as well at the same time. Okay. Now we're going to move on to upper limbs. So technically I would move this down and take a look at your upper limb, but we're just going to go with what we have here. So I'm going to palpate. We already palpated the clavicle and palpate the shoulder. I'm going to go ahead and palpate your arm here. I'm going to feel for your epitrochlear lymph nodes. Feel your forearm, your wrist, and your fingers and hands. Good, we already checked those pulses. I'm also going to check your axillary lymph nodes. So I'm going to stick my hand up in here. I'm going to grab this little area here. Sorry if you're ticklish. And then up in this area. Okay, I'm going to do the same thing on the other side. So palpate and inspect the shoulder, and the arm, the elbow, and the epitrochlear lymph node. Forearm, wrist, hand, and fingers. Okay, and I'm going to check your axillary lymph nodes on this side. So, okay, I'm going to feel it this way. Okay, very good. So for this part, I'm going to have you stand up so we can do range of motion of your shoulders. So you can follow my movements, okay? You're going to go up, forward, flexion, okay, and then go backwards, but be careful not to hit. There you go. Okay, now out as far as you can that way, okay, and cross in the middle. And I want you to take your arms up like this and then down like this. Very good. Now I'm going to do it for you one on each side. So I'm going to have you turn this way a little bit. All right, I'm going to do flexion and extension, abduction, adduction. And I'm just going to take you an external and internal rotation. Very good. We'll do the other side. So again, flexion. Just go ahead and let me do it. Extension, abduction, and adduction. Okay, and bring it out. So external and internal rotation. Very good. Let's check your strength first. Let's check your strength. Okay, so for this one, push out, push back, forward, and in. Very good. Now for this one, if you can just push me forward and back like that. Start like this, go up, there. Same thing. This, forward, and back. Very good. All right, now we can move on to the elbows. So again, up like this, down like this, back to midline, and rotate in and out. Very good. I'm going to do that for you. So up, down, in, out, up, down, out. Okay, now we're going to test you for strength. So push up for me. Good. Push down. Good. Same thing here. Up, down. Oh, down, down. All right, now I want you to grip my hand and turn in and out. Good, same thing here, in, out. Very good. Okay, now wrists. So I want to take your wrists up like this and down. I'm going to go out and in. Good. So up, down, in, out. Up, down, out. Ooh, that one crunched a little bit. All right, now you're going to do it against some force. So I want you to push down, push up. Okay. Push down, push up. Good. Now spread your fingers real wide, close them. Okay, good. Spread them again. Don't let me close them. Good. Now I want you to grip my hand. Grip as hard as you can. Don't let me pull my hand out. Good. Did we miss anything? I don't think so. All right. Next we'll move on to the neurological exam. Okay. All right, next we're going to move on to your neurological assessment. As we've been going through the exam, we've kind of tested a few of your cranial nerves, actually 1 through 12. The only thing we haven't done is test sensation on your face, which we'll cover in a little bit. But first we're going to do some of your reflexes. So for this, I just need you to try to relax as much as possible, okay? Good. Relax. I know it's easier said than done to relax. Good. Good. Just relax your arm as much as you can. Okay, I want you to try to grip that side of the bed over there so I can try to get you to relax a little more. There we go. All right. Same thing here. I'm going to do it this way. Just relax your arm. Relax. If I drop it, it should fall. Relax. There you go. There you go. Relax, relax, relax. All right, that'll work. Next, we're going to move on to your patellar reflexes. So I'm just going to pull these up. Same thing here. Okay. Oh, nice one. All right, now your Achilles. So just try to relax. Good. This one too. Good. All right, last one. We're going to do your Babinski. Okay. Okay. Got those. We got the reflexes out of the way. I'm going to wash my hands really quick. All right. Next, we're going to test the vibration sensation. So this is a tuning fork. It makes vibrations. You can kind of feel them like that. I'm actually going to place it on your big toe. Okay. So have your eyes closed, and I want you to tell me when you feel it and when you stop feeling it. Okay. Feel it? Okay. Let me know when you stop feeling it. Very good. Same thing on the other side. You can feel it? All right. Let me know when you stop. All right. Good job. Okay, next up I'm going to test your sensation. Okay, so this is soft, this is dull, and this is sharp. So I'm going to test you on your face, and then we'll do a little on your chest, arms, and legs. Okay, so I just need you to keep your eyes closed while I'm doing this, and you're going to tell me what type of sensation you're feeling and where you're feeling it. Okay, so we'll start up here.
Dull on the left side,
Okay.
sharp on the right, soft on the right, dull on the left, sharp on the right.
Good. I'm going to pull this down just a little bit so I can see your chest. Okay. So
Sharp on the right, dull on the left, dull on the left, soft on the right, and soft on the left, dull on the right, sharp on the left, soft on the right, dull on the right, Soft on the left. Dull on the left. Sharp on the left. Soft on the right. Dull on the right. Soft on the left.
Great. Good job. You can open your eyes. Next, what we're going to do is test stereognosis. So I'm going to place an object in your right hand. I'm going to have you hold it open with your eyes closed. I'm going to place it in your hand, and only with this hand you can feel, and you're going to tell me what you have in your hand, okay?
A coin.
Very good. All right, now open your left hand, please.
A key.
Very good. Okay, you can open both eyes. Next, we're going to test your coordination. Okay, so we're going to have you do patty cake on your lap, and you can start slow, flip it up and down, okay, and then go as fast as you can. Very good. Okay, now I want you to test the coordination of your fingers, so going one to the other, and then go as fast as you can. Very good. Next, we're going to test finger to nose. So I want you to touch your nose with your finger, and then touch my finger. You're going to go back and forth, first starting slow, and you're going to go a little bit faster. Very good. Now you can slow back down and do it with your eyes closed. Okay, open them back up. Now I'm going to move my finger, and I want you to keep up. Okay. All right, very good. Now let's try it with the other hand. So just normal first, nice and slow. Gain your distance. Okay, good. Now a little faster. Okay, now you can go a little slower. Close your eyes with your eyes closed. Good. Now open up. All right, we're going to go different places. Get that coordination. Very good coordination. All right, very good. We already did ankle pats, and we already did walking. So next we're going to do the Romberg. So I'll have you stand up, feet together. All right, I just want you to stand there with your eyes closed. And we'll do this for 30 seconds. And 30 seconds has passed. Very good. Okay, open your eyes up. I want you to stand up with your hands out like this in front of you, a little higher up. Very good. And I want you to close your eyes again. Try to stand as still as you can. We'll do this also for 30 seconds. And 30 seconds have passed. Okay. And that completes the neurological exam. Thank you.